Can you hear me? All right, great. Thank you, everyone, for being here today for our Partners in Progress workshop series. As you know, today is on the state of youth homelessness in the Capital Region. We have a great panel and some moderators here for us today. But first, just a couple of housekeeping notes. Bathrooms are out the doors and to the left. As many of you have seen, there are refreshments in the back. Please feel free to help yourself. If you didn't already, there is a sign-in sheet in the front, or in the back, and a variety of materials for you to collect that we'll be going throughout the presentation. Also a note, we are live streaming and recording this for our remote partners and for folks who couldn't be here today. So this is our second time trying this, so bear with us if we have any technical difficulties. All right, and so moving on. Today we are very lucky to be hosting an expert panel to speak on the important issues of youth homelessness. We have two moderators here with us, Mary Capagna and Andy Gilpin, who will be leading a presentation and then doing some Q&A with our panelists. So to introduce you to our moderators and panelists, Mary Capagna is an advocate for homeless, runaway, and youth in crisis in our community. Over the last 26 years, she has developed innovative program services that include an emergency shelter, transitional living program, street outreach services, and an outreach center. She currently serves as the Director of Grants and Special Projects at St. Anne Institute. She holds 2 master's degrees in counseling and social work. So welcome, Mary. Thank you for being here. Our second moderator is Andy Gilpin. Andy is the Associate Executive Director of Captain Community Human Services, formerly Captain Youth and Family Services. Andy has been with Captain since 2010 and has worked in nonprofit sector for 17 years. He has been involved with the runaway and homeless youth field for the past 9 years through Captain's Runaway and Homeless Youth Shelter, street outreach project to homeless youth, and work with commercially sexual exploited youth under the New York State Safe Harbor funding. Andy is also the co-chair of the New York State Office of Children and Family Services Runaway and Homeless Youth Advisory Council, and leads numerous continuum of care committees in the Saratoga North Country area. Andy holds a bachelor's in political science from Indiana University of Pennsylvania. Thank you, Andy, for being here. Margaret DeVries serves as the executive director for Wait House, a homeless youth shelter in Glens Falls, New York. She has always had a passion for working with the homeless community and has been with the organization since 2007, beginning her career as a case manager. This has allowed Margaret to develop a true understanding of the ins and outs of programming, as well as the ever-changing needs of residents. She is a graduate of the College of St. Joseph's with a BS in Human Services. Margaret is active within the community as well as the continuum of care, serving on several committees. Welcome, Margaret. Natalie Lindop Brown is Associate Director of Homeless Services at Joseph's House and Shelter in Troy. She has a background in public health and has been working directly with homeless individuals and families for the past 4 years. As part of her work at Joseph's House, she and her team have collaborated closely with the community-level organizations to provide appropriate and safe shelter and referrals to homeless youth across Rensselaer County. Natalie is also a member of the Troy Drug Court Advisory Board. Welcome, Natalie. And last but not least, Dominic Ruggieri, did I say that?
Ruggieri, close.
Ruggieri, thank you, is Director of Youth Services at Equinox. Dominic has been in the correctional and human services field since 1989 at various state and private agencies, working the majority of the time with 13 to 24-year-olds. He has been part of many advisory boards and consulted with numerous agencies dealing with all aspects of issues facing juveniles over the years. Dominic received a BS in criminal justice with a business minor in 1989 and immediately started his career working with juveniles in New York State. So welcome to our moderators and panelists. We're very fortunate to have you here today to talk about the important issue of the state of youth homelessness. And now I would like to turn it over to Mary Capagna and Andy Gilpin to talk a little bit about the state of youth homelessness in our community before hosting Q&A with our panelists. So thank you so much for being here.
You're welcome. Thank you. Thanks for having us. I want to recognize and thank the CARES, first of
This is so nerve-wracking. I just have to tell you this with all these wires. Okay. I want to recognize and thank the CARES staff, especially Kelsey Addy and Aaron Reel, without whom this panel would not be taking place. They provided us with guidance, technical support, answered all of our questions. So thank you very much, Kelsey, and I know Aaron's not here. I would also like to recognize our colleagues in the community who've worked with homeless youth. I see so many of you, this whole row here, Teresa, Alex, Maura, Nicole, Kevin O'Connor, who's an icon in our community and knows more than probably all of us combined. And for those of you who have never worked with homeless youth but have come today to learn a little bit more, I thank you for your interest in this population. So, a few months ago, I was asked to speak at Bethlehem High School, and I began by asking the students how they would feel about a certain number of scenarios. I asked them how they would feel if they were bullied. I asked them how they would feel if they were failing in school. I asked them if parents were getting a divorce, how they would feel. And they all answered those questions. They all had responses to those questions. And then I asked them the following questions. Tonight, where will you sleep? Tonight, where will you eat? Tonight, where will you shower? Tonight, where will you find your belongings, your shoes, your clothes? Tonight, who might help you with your homework? Tonight, would anyone be there to listen to you if you just wanted to talk? Would they know that your inability to talk is because the pain inside them hinders that ability? That you might want to talk about the unspeakable horrors of sex abuse, the pain of a leather belt or a fist? The youth we work with have no answers to those questions. And that's what separates them from the general population of youth in our community. So who are these youth in our community? I think the reasonable place to start would be by first defining homeless youth. There are primarily three categories of homeless youth. I think you have those definitions in your packet. Runaway youth, throwaway youth, and homeless youth. There's also a category of youth that are just called couch surfing youth, but couch surfing youth are represented in all three of those categories. They move from one temporary housing place to another, often in extremely high-risk situations. So a runaway youth is a youth under the age of 18 who is absent from their legal residence without the consent of a parent or legal guardian. Generally, that youth is run away from home due to abuse, neglect, or maltreatment. A homeless youth is a person under 21 actually, I didn't type that correctly, who is in need of services and is without a place of shelter where they can receive support, guidance, supervision, and care. The youth could be homeless for a variety of reasons. They could also be homeless because their parents are incarcerated, their primary parent has died, or the parents are homeless themselves. Throwaway youth are a youth under the age of 18 who have been forced to leave their home by a parent or legal guardian. Youth in this category have been told, forced, or pushed out of their home by caregivers with no alternate, safe plan for them. But let's have the voices of youth breathe some light into these definitions. So a runaway youth, and these are from youth in our community. I will not go home again. I have yanked my mother from a bar for the last time, undressed her because she was too drunk, taken the last blow from my grandfather, and heard the last of my grandmother's screams. I'll go any place, but I'm not going back home. I'll keep running if I have to. I've had enough. A throwaway youth. Go. Get out. I can't take it anymore. You're on your own. Go live somewhere else. I don't care if you live. Never never come back here. I've struggled single for far too long, and you're not going to mess that up. A homeless youth. My early memories of my parents are filled with images of their drug use. You name it, they did it. After years of using the hard stuff and seeing my mother shooting up at the kitchen table and feeling such fear because she became a different person when she did that, she died at 39. My father is now incarcerated, and I'm 16 out here trying to live on my own. My relatives tried their best to take care of me and my brother, but caring for teenagers ain't no easy job. I'm doing okay, but most days I just feel lost. So what puts our youth at risk, at greatest risk? The lack of a high school diploma puts youth at greatest risk. They are 300 times more at risk if they don't complete high school or get a GED. Pregnant and parenting youth, extremely high risk category, not only for themselves but for their minor children. Youth who live in poverty, and in Albany, in certain zip codes, the annual income is $29,000. That's poverty. In Rensselaer and Schenectady, there's a 12% poverty rate. A lot of poverty in our capital district, as we all know. LGBTQ youth, extremely high youth risk, and they often fall into the throwaway category, where parents just want them out. And youth who have once been in the foster care system are extremely high risk. And finally, black youth are nearly twice as likely to have experienced homelessness as their white peers. Hispanic youth, 4 times more likely. So, I've been charged with giving a little history here, possibly because I'm the oldest person in the room. So, what has our society done? You need to think way back. During the 60s, there was a lot of runaways, but it was very different then when the hippie generation took place and people were going to California and San Francisco and running away. But then, like so many pieces of legislation that have been passed, Megan's Law, I think the Amber Alert, and other things in our society, there was one very dramatic event that triggered the passage of legislation. And that was the discovery of 28 bodies of teenage boys you have in your packet. All of those boys were found buried in a shed and near the home of serial killer, I'm not going to mention his name, but a serial killer. If you read the inscription, the reason this was so compelling, not only that it shocked the nation, but that the police were very quick to list these boys as just runaways. They'll come back. You know, they're just gone for a little while. They'll be back. They didn't consider them worthy of any major investigation. And as one of the boys' mothers said, my boy doesn't run away in his bathing suit and 50 cents in his pocket. The parents knew better, but they couldn't get the police involved. As a result of this, Senator Birch Bayh from Indiana, my personal hero, began hearings in Congress. And he chaired many, many congressional hearings about runaway and homeless youth and other issues that impact that population. He heard from youth, he heard from providers, he heard from all kinds of people that had been working with youth, not only runaway youth, but youth in general. And as a result of those hearings, the federal government passed in 1974 the Runaway and Homeless Youth Act. That piece of legislation allowed for funds to be made available to open runaway and homeless youth shelters. 4 years later, New York State passed its own Runaway and Homeless Youth Act, mirrors the federal. And that too authorized funds for runaway and homeless youth shelters. As the years progressed and we got into the 1980s, both at the federal and the state level, providers were seeing that even though a kid could come into a youth shelter, there really was no place for them to go if they couldn't be reunified with their families, and many of them couldn't. So they set aside funds to open transitional living programs. And in the 90s, street outreach programs. So that's how the funding for those programs. And there's two funding sources, as I said, both federal and state. I think our panelists will talk about the programs that they work with that were made possible by the funding. So what's being done in our community? A couple of things, and at the federal level. First, CARES, and thank you, CARES, created the Capital Region Advisory Group on Youth Homelessness. Andy and I chair that committee, and we've been working for 3 years, and Andy is going to talk about our work. What else has happened that's on the positive side of this equation? The Safe Harbor Law was passed. Teresa and others, I think, was the first person in our community hired to work under the Safe Harbor Act. The next positive thing is that HUD in 2016 actually put a priority on runaway and homeless youth and promulgated rules and administrative directives to say that they wanted to end youth homelessness by 2020. That was a big deal because in years prior to that, HUD never even considered this younger population to be eligible for HUD funding. That was a very big deal. Another positive is that OCFS, and I see Robert, I don't know where Robert is, but I saw him. There's Robert, extended the age of services up to 25 and extended the length of stay in our programs. So that was a positive. So I'm going to end with what are the threats. The first threat is that in 2017, there were still 2,300 youth identified as being trafficked or at high risk of being trafficked. That's a threat. The Runaway and Homeless Youth Act funding, huge threat. In 2008, we were receiving $6.31 million of funding to fund the programs across New York State. In 2012, that funding dropped to 2.57 from 6.3 million. Then it went to 2.3 million. And I think it's hovered around that amount since then. That was a huge loss for us. Finally, we have a number of youth that were surveyed that Andy's going to talk about in our point-in-time count. We have many youth that are captured through CARES and HIMIS, which other people will talk about. And we still have, according to OCFS, 5,292 admissions to runaway and homeless youth programs in New York State. And SafeLine, which is a hotline for runaway and homeless youth, received 155 calls last year for youth in the from youth in the 518 area code. So we still have a lot of threats. But I think a more recent threat, which is troubling to me, is that a few months ago, when our current administration in Washington appointed a new commissioner of Health and Human Services, he said publicly that he thinks the programs and the work we do is wonderful, but he also believes that you should fund programs for 3 years and then give other people a chance to start other programs. That was very disturbing to me. And we had a little conversation about that. Yeah, he wasn't really hearing it, to be honest with you. So that's a concern, because he's going to be in that post. He was recently appointed under this administration. So that's another threat. So much has been done, much is left to be done, and at this point, I think I'm going to turn it over to Andy.
Thank you very much, Mary. That was wonderful. Thank you for the view of everything and where we came from and how we got here. And I just always value your context on runaway and homeless youth. In the packet, I think I was going to go over the two things that we want to try to review today. The first one was the current state of where we are with runaway and homeless youth programs. So what we had was this handout that shows you sort of a box of text and a dog on the screen. And
That'll be up there.
yeah. So we definitely. That's nice, right? Well, we worked to try to just categorize and find a way to kind of put it on one page so everybody can kind of view what it looks like right now for the Capital Region. And this is basically the array of services that are available right now. It's going up and down, like Mary said, as funding comes and goes, as programs can sometimes piece together, because it's not always just the federal money or the state money. You really need to do fundraising. You need to find other foundations, other resources to try to keep this going, because not one source funds the whole thing. Right. I think that's part of how all the runaway and homeless youth program services operate. They really have to be committed to it and really search out all of that funding in different ways. So based on that, I kind of did as a continuum across there. If you look at it from street outreach on one side, permanent housing on the other, at the right side, that's sort of the continuum we would like to see for youth, to have them as available services. And we do check a lot of the boxes. I think the one important thing to remember is that youth can enter at any point in time. There's not one, say, that you have to start here and end there. They can come in at any time. And I think the other beauty of runaway and homeless youth programs is you can bomb out of any of these, right? You could, for whatever reason, any life circumstances, and we know youth change their mind and things happen and they pursue different things, or things happen to them. But many of these programs, even if you didn't make it at the transitional living program, you'd still be eligible to come back to the shelter, right, and start over and kind of get your feet under you again. Or you might not have made it through the permanent supportive housing. You may not have been able to maintain that apartment. Then you can come back to another source. Maybe it's a transitional living program, or maybe it's the shelter. Or we meet you on the street and we're starting to work you back to where you can be independent again and back to a situation. Or they might be at home, right? They might have made a reunification with their parent, guardian, family member. That goes south. They can come right back in at any point in time. So different than adult systems. A lot of times with adult systems, you get sanctions, you get different hurdles that you can't get through with paperwork and other kinds of stuff like that, which youth are notoriously not great at navigating those systems, right? So we are much more open, I think, much more low barrier, and working with youth, kind of in a housing first model. Like, this is how you present, and we'll be able to work with you, right? So right now, currently, street outreach, there's five. 5 programs that work. Saratoga, Albany has 2, Schenectady has 1, and Wade House and Warren, Washington. So there's a lot of street outreach happening in the communities. And the programs can talk a little bit more about what they do with those street outreach programs. For sheltering right now, there's Captain and St. Anne's over at Hubbard Hall that do 13 to 17. That's their population they work with. Safe Inc. and Wade House. So Safe Inc. in Schenectady, Wade House, Warren, Washington. It's more 16 to 20, but I know Margaret is moving that up a little bit. She's taken on the different challenges working with youth that are older, and she'll talk a little bit about that as well. As far as transitional living programs right now, that's been a very difficult population, or not program-wise. I mean, the funding for that is fairly limited and super competitive, so that programs find themselves being funded, just like Mary said. You have a set of 3 years, and all of a sudden you're funded, and next thing you know, you're dropped off the cliff, and you have to figure it out. So we've had programs come in and out. We've had bed availability that has been up and down with that, but it's definitely the critical link between that permanent housing, right? So you can't usually take a kid from the streets or a youth from the streets and pop them right into an apartment and expect that they're going to be doing everything they need to maintain that living situation. So the transitional living programs are the nice bridge between that. But Equinox and Wade House both provide that. 16 to 20, am I getting that right?
21.
21, there we go. Permanent supportive housing, that is a piece, we've talked a little bit about it up at the panel right now this morning, but that's a piece that is sort of missing and is new, I think, in our area and probably needs to grow, and there's money out there for ESHI funding, and there's other opportunities. People are taking that on. It's definitely a critical link because the adult population has had permanent support for a while, for a long time, so having that component for youth is critical. So they don't have to worry. They have a place. They have a case manager, support services. They have rental assistance as needed, and we can get them through to where they're starting to become more independent. And then the last piece I had on there was the permanent housing through rapid rehousing, so apartment of their own, right? So that's a population that's a lot of times been adult, but for now, there are more programs focusing on youth as well to try to help them transition. I know Margaret does a really great job with that progression through her programs. And so she can talk a little bit about that as well. But those are basically the available services as of 2019. There could be more coming, hopefully. I mean, that would be our goal. And some of the information we'll go over really with the youth count and what we had from past 3 years of doing the youth count will kind of illustrate some of that. The other box down below there, Safe Harbor, I just mentioned that as a way that's a feeder for the programs as well. We get lots of referrals, and that's a housing resource for those programs because a lot of times kids and youth who are in situations and have been identified as a victim and or high risk, they need housing, right? That's one of the key pieces to keeping them stable, not falling back into the lures of the exploiter or the trafficker, right? So it's a big feeder. And then bottom is really just where we get referrals and how those referrals can connect. So there's no contact numbers here, but all this information is readily available online. All the programs do a great job of putting out there what and how you can get in touch with them. So just want to give everybody that. If there's any questions, we can get that maybe in the Q&A section of that. Good. The other piece that you got, I think everybody got this, right? The 2-page, that kind of, so it's a little bit more than 2-page, or it does. Oh, you did. Okay, I had to print it out at 4-page. I didn't really. It's a wonderful job. So again, huge shout out to CARES. They have been an amazing partner.
Amazing.
Yep, with us in this and the support they give for the Capital Region Youth Count. So 3-4 years ago, we decided we wanted to do something to get a different count than we get the point-in-time count, because the point-in-time count that happens in January, again, with HUD is a little more adult-focused. Definitions don't work very well for youth. Youth are being undercounted, underrepresented. Great work out of Chapin Hall and Voices of Youth Count, and Mary is a great driver behind that to bring that to our attention. They were doing incredible work, and you should look them up. They have, I think we've been doing it for maybe 4 years, maybe longer. So it's a Voices of Youth Count, and it's from Chapin Hall. So I think if you Googled either one of those two, you could kind of see where that is. And that's a nationwide effort. So they have a whole toolkit on how to conduct a count, who should be involved, where you should be looking, sample surveys, sample planning strategies. But their information is aggregated from the nation, and they have revealed a lot of great information that rural poverty and rural homelessness is pretty darn close to urban. So the numbers were almost exactly the same, where it was considered before, where urban was probably, just by, population would be higher, but the actual numbers are very much the same. So there's a lot of great information about what communities can do around youth homelessness comes out of that based on their surveys, types of programs, things like that. But again, I think Capital Region is positioned very well with the spectrum of an array of services as well. But from this, it's been the 3rd year. We have lots of partners. It covers 8 counties. We're bringing in all the providers and other volunteers and trying to work together at the one day. We usually pick it in October. This past year was October 18th. It's been around that same time frame every year. We felt that that was a good balance to try to find youth. It's still very warm, so street surveys should do very well. Sometimes point in time in January, the street homeless and surveys don't go as smoothly as you can probably get with October, so we picked that. And we try to really get 3 data sets. That's what we wanted to focus on. So they are distinct. You need to know that they don't, we have no way to deduplicate the information you get from those 3 data sets. So just keep that in mind, that if we met a kid on the street, they may have the next day been in program, or they were already in school and they were homeless identified. So there may be some overlap within that, but I think each distinct data set gives you some really good information. So again, huge shout out to Terry for helping us aggregate this data and put it together and pull out. Some of our meetings were not as, we all wanted something a little different, and we all had some ideas well with this, but they were able to distill it to this great thing. So I think the major findings, I'm just going to review that really quickly and then go back to the 3 data sets. But we want to give a level set as far as the first bullet there, that over the course of the year, this is what you can see, right, from the capital region, not just at one point in time. But just mirroring some of what Mary was talking about state numbers, but 1,076 unduplicated, unaccompanied youth were identified. 20 of those were parenting youth. They either stayed at emergency shelters or transitional living situations. That data was pulled from the Homeless Management Information System, the HMIS, which is a data aggregating site that most programs use to input information and then pull back out reports, and that goes to the feds or the state or any other place like that. They're basically, from homeless students, a 15% increase from the 2017 to 2018 count. So that's really looking at the same. So we got more participation this year. We had 33 districts participate last year in 17, but this year in 18 we had 55. So there was more participation, which was great. We got more information. But for that number, it was really the people that reported in 17 and 18. So that is a distinct jump in 15%, just based on those reporting both years. I think the big one, the third bullet point for me, was important. So looking at the surveys from 17 to 18, there was a 56% increase in homeless youth identified on the street. So I think that's, yeah, I think that was the big thing that I pulled from that. Other stuff, you can see 19% of those youth that said they were homeless were actually staying in a place not meant for human habitation, so on the street, in a car, in a place not meant for staying. So that's a big number when you're just thinking of one night or one day of surveying kids. I think the other 2, I'm going to get back to it a little bit, but the last 2 bullets, 1824 represented the most of our population that we saw with those street surveys, right? And also there's a correlation between the numbers decreasing from who was actually in program. So I think that, I'll get that to in a second, but the same thing, youth of color were 2 or 3 times more, which mirrors what Mary was saying earlier. And the last page with HMIS will kind of get you there. But just to really view, then the next 3, then the school data. So just so you know how we're doing this, we're basically sending out contacts, an email, letter, making contact with the school liaison so each district, because of McKinney-Vento legislation, it's federal legislation, they're required to have a homeless liaison at each district. And that district, then a homeless liaison works with the families who come in, register as homeless. And their definitions are a little different, so we added that there. Just individuals who lack a fixed, regular, adequate nighttime residence, which includes doubled up. So those are a little bit looser than the definitions for HUD, with their various categories and things that you need to check the blocks for homeless. So it does encompass a larger population, that more people are considered, or more kids and families are considered homeless under McKinney-Vento. So the liaisons, they work with the students, they try to get the resources they need, they get support, they transportation to and from. So if a youth moved out of district for whatever reason, doubled up somewhere, they can still get back to school. So that's the main point of the McKinney-Vento, is that school is sort of a stabilizing factor in their life. And so if they're keeping with their school, with their friends, with their cohort, then that's a stabilizing factor in their life, right? And so we put this out to the liaisons. They respond back who is on your caseload currently for the October 18th from 13 to 21. And of those youth, how many are unaccompanied? So unaccompanied basically means they're not with their parent or guardian, right? And so the numbers are down there. You can see it. I think it's shocking to know it's 591 homeless students. Now, that's a big number, I think, for if you look at the number of youth that we're dealing with that are actually homeless. And then of those, 132 were unaccompanied. So represented 27% increase in the unaccompanied youth, which was significant for us. We didn't know that until that data came in. So we can kind of tell that as providers, who's coming in and out of the shelters or the transitional living programs or things like that. But that was important to know. The next data set was truly the surveys. So if you looked at that, and I won't go through everything here, but I think the big thing we talked about, 18, 20, or 24-year-olds were the ones that were mostly represented. And it increased by 52% from the prior. So I think that's really important to know because it connects with the HMIS data. I'm not going to dance around any longer. So there's a decrease in that 18, 20, or 4-year-old population in shelters, transitional living program, adult sheltering system. So then there's more on the street, right? So that means that decrease on one side, they're going somewhere, right? So we saw them increase. I think it can be correlated pretty easily. Same thing with youth of color, right? There was a decrease in the amount of youth being housed through emergency sheltering stuff, but increase on the street, right? So you can see the correlation that if they're not in program, they're going somewhere else and finding their resources somewhere else. And so I think it bears the question. There's a few things that come out from that, but are we really tailoring the programs that we need for that population of youth 18 to 24 and youth of color? Are we thinking of it in our programming, in our cultural competency? What are we missing that youth are not coming into shelter, transitional living programs, the systems that are set up, and why are they staying on the streets? So, and I'm not sure what else to get from the HMIS data. You can read through it, but it hopes provides numbers and context for where we want to go with next steps. And really next steps is identifying those gaps and needs. How can we address it through either collaborative effort, individual effort for those organizations that want to take on the challenge to find the resources, or how can we just work better together with those programs that are trying to come online or already existing to meet those gaps.
Okay.
Yeah. Excellent. So what we thought we'd do next, I think, and then we'll get some of this Q&A that you guys can ask questions about any of this stuff, but I think our next was to talk to the experts here to find out from their side of view, from the program side of view, what they're seeing. So, yeah.
Thus far. Does anyone have any questions thus far? Okay.
All right. Maybe we'll just, is it okay to go down the line? All right. Sounds good. We'll start with Natalie. And we had basically, I'd like to give a little introduction to yourself and the program, talk about your program, but then we had a series of questions I just want to ask about the population and what you saw. So I'll let you go ahead.
So my name is Natalie Lindop Brown again, and I'm the Associate Director of Homeless Services at Joseph's House and Shelter. So I just wanted to say quickly that we, in addition to our shelter and outreach program, we also have supportive housing programs for formerly homeless individuals and families. But the information that I'm going to be sharing today is really specifically about our homeless services program. And we operate out of downtown Troy in Rensselaer County, and we serve all homeless individuals in Rensselaer County of all ages. And a segment of that population is in the 18 to 23, 24-year-old range.
Excellent. So what's the profile of the youth you typically serve? I mean, you kind of said a little bit there, but what's the profile for them?
So we, like I said before, we are operating an emergency shelter, an outreach program, and in the wintertime we have a Code Blue program. So the stats that I'll share are kind of an average among those programs, but our average age is about 21 years old. And when they, last year, upon intake, about 35% said that they are living with a disability. And we think about that as, that's before you've really developed a relationship with anybody yet. So that may be kind of on the lower end of what the actual number may be. But that's a little higher than the previous 2 years. That might just be because of the difference in the number of data we were able to collect. But so there's that. There's about a little over a third of them reported having income, of youth in particular, reported having income on intake. So that's something I think that a lot of people don't really realize, that youth are coming in working, or they might already have SSI or SSD. Youth, especially parenting youth, might come in already connected with public assistance or some other kind of assistance. And the average income in the 2016-2017 time was about $700 a month. And last year we got $560 as the average. But that's pretty, it seems like it's been pretty stable in our HMIS data. But what it demonstrates is that, to me, that long-term housing, affordable housing, isn't really available on that level of income. And across the programs, we have the average length of stay for youth was about 24 days. I think in our Code Blue programs and our very, very low barrier programs, that tended to be shorter, or we'd see them multiple times. And then in our emergency shelter, it would be longer. They're working closely with a housing advocate at that point. And sometimes we had youth stay for a really long time. Not many stay for more than 100 days. But those are the youth that we see who come in. There's a lot of barriers to housing. Even though we're a real housing first focused program, there's a lot of other things to overcome before we can actually get them to an affordable permanent housing solution. So I guess it might be interesting to note just where people are coming from and where they're leaving to. We tended to have a lot of our youth coming into program from other emergency shelter programs. That might be our own emergency shelter program, our outreach program, our Code Blue program. A lot of them came from doubling with friends and family. And then some of them came from places not meant for human habitation or for habitation. I would say, though, that some of the ones that we work with most closely, some of the most challenging cases, come from discharges from institutional or supportive settings. That's about 10% of our youth over the last 3 years. And sometimes they've signed themselves out, or sometimes they've been discharged, and they don't have a lot of wraparound services at that point, and there's a lot to address. So just to give you a little bit of a picture of these youth, we had most recently we've worked with a few. We had one that came to us. She was couch surfing. She signed herself out of residential care when she turned 18, and then she was couch surfing, and she literally just walked in our doors and was like, "Can you find me an apartment on my own?" We had another youth who she'd been staying outside for almost a year. She was already connected with a bunch of services, but she didn't know about shelter services at the time, and was finally pointed towards us. Our outreach worked with us, and then she agreed to stay inside. And she ended up staying with us for a very long time, actually, before we were able to find a housing solution that worked for her. And then we had a young woman who came to us recently who couldn't tell us where she was coming from. She came in our doors, and she could tell us her first name. We really didn't have much more information than that. And after a lot of engagement work and a lot of trust building and things like that, we were able to determine she'd actually been to DSS, Department of Social Services, initially. She had an event there. I think she slammed her head into the glass and was hospitalized. And then she discharged herself AMA, against medical advice, from the hospital and literally walked down the hill to us. And so that whole story took a really long time to get out, and then we had to, work on, okay, so what are some goals that you would like for your housing? And she's still county hopping, actually, which is a real challenge with our youth. Lastly, another kind of example of a youth that we're working with is a young man who came into our Code Blue program. He would come in late at night. We didn't see him very much. And then he got involved with our syringe exchange. So we have a partnership with Project Safe Point through Catholic Charity, and have peer exchangers on site. And so he started to engage with and exchange a peer who would take his dirty needles, give him clean needles, and education about safe heroin use. And after developing that relationship, he trusted enough to continue to have relationships with other staff, and we were able to start to work towards housing. Unfortunately, he's kind of in and out of incarceration right now, but he keeps in touch with us, and we got a letter recently. So that's a little bit of the subset. Do you want our numbers?
Sure. Yeah.
Okay.
If you could share your numbers from, this is 18, and some other numbers, whatever you say trending-wise. Yeah.
Yeah, so the trends that we've seen are we're trending slightly down, I think, in our numbers, which it sounds like is pretty similar across the board. In 2016, we had about 90 youth in our programs. And I just thought I'd throw in that it is interesting that we're able to work with youth of all ages and in kind of all different situations. So 8 of those 90 were actually parenting youth. Some of them were as young as 17. In 2017, we had 87 in our program, and 11 of those were parenting. And then the last year, in 2018, we had 80 youth, and 10 of them were parenting. So that's a little.
Yeah, so the parenting is staying kind of consistent with that number of, you said 10, 11, 8. Yeah, it's all about the same.
Yeah.
Sure, sure.
So Margaret, do you want to talk a little bit about your program?
Yeah, sure. My name is Margaret Tavris. I'm the executive director for the White House. We're located up in Warren County, Glens Falls. We actually opened up our emergency shelter program back in 2003. It's a much smaller scale compared to the other folks up here. We are co-ed facility. We can take 2 dependents, and it's a 30-day, possible 60-day stay. And then back in 2010, we, based on the need of, pregnant and parenting, which I think our TLP, a lot of programs, and there's not many, but the programs that are around here for TLP are co-ed. I was just, talking to Dominic a little bit more about his program. And ours specifically is actually just for females. And the focus there is pregnant and or parenting, although we can take single women as well. But that program was open because of the need, and it was so prevalent in our area, and there was just non-existent. So we are able to take 5 females there and 4 dependents. And currently right now we do have 2 young ladies, which one of them has 2 children, a 2-year-old and I think a baby, very, very small. It's about 2 weeks old. So she's been with us for a little bit, and is struggling, and we're there obviously to help with those struggles as she's really becoming a mother of 2, which I couldn't imagine. I have 1, and it's a struggle. So it's a great program, and thanks to there was a mention earlier, we move forward with the increase of age, and White House is the first. Thank you to OCFS and their support. White House is the first runaway and homeless youth shelter certified by OCFS to move forward and get our new certification. So we can actually house, and this is for both of our shelters, 16 through 24, so a day before their 25th birthday. So we're very excited to share that with the community partnering agencies, because the need, as you guys can see from the data, the need is there. So one of the moms that we do have, she is 24 right now. So we're excited to see those youth come through the doors. I definitely anticipate an increase of numbers, which is one thing I think we were talking about. For us, in 2017, and this is an emergency shelter, we served 94 youth, and in 2018 it was 70 youth. People always ask, well, why? Did we solve homelessness? I said, absolutely not. We didn't solve the homelessness. I think, in being in this field, these youth are very different than they were back in 2007. The needs are very different than 10 years ago. And programs are very different. And I think, for youth that have been around and have lived in this cycle, some of them are just not ready to participate in a program, and sometimes to follow rules and to really want to make those changes. And I think that is some of the reason why our numbers aren't as high as previous years. For 2018, we had 47% of youth come through our shelter who were suffering with mental illness. That's pretty significant, and unfortunately, I don't see that slowing down, that number decreasing. 47% of them had conflict with parent or guardian, and a majority of them were asked to leave. Majority of our youth are homeless. We do have a few run away throughout the year, maybe 4 or 5, which that number has increased from year to year. But most of our youth are homeless. 30% came in with limited or no education, whether they were a dropout, and then 37% had issues with employment, whereas they've had several jobs, unable to keep a job, or no employment whatsoever. We see a lot of youth coming in, and I'm sure I can speak for the other 2 panelists with family issues, neglect, severe neglect, abuse, economic issues, and a lot of the youth have lived in poverty most of their lives. Their family has been homeless. I actually had a young lady who we've been working with, and she had turned 21, so she had to exit our transitional living program. And she ended up going back with Mom, and her and Mom's relationship was just very dysfunctional. There was a lot of abuse, violent with one another. Mom has been, I think she had lost her housing, a Section 8 voucher, and within several days, I think there was police involvement, and she ended up going up to the county and spent some time in a hotel, but luckily she was able to work with our street outreach program, which is another program that Wait House does offer, which Andy mentioned. So we were able to still connect with her, offer services, although she wasn't able to come back to the shelter. We were able to get her into Section 8 voucher, which was great. We have a great relationship with our local housing authority. With our STEP funds, our rapid rehousing, which is another program Wait House offers, we were able to help her financially get into an apartment and then offer some additional case management, which is great because a lot of these youth, if there's no program or case management attached, they just fall through the cracks. A 19, a 20-year-old, even a 25-year-old, it's difficult to be out there on your own and to find your way through life when you've never had to experience. I can't speak for everyone in the room, but a lot of us have had some sort of structure or some sort of guidance, and a lot of these youth, they don't even know what that means. So she did fairly well, but unfortunately, and it's really based on the cycle, her mom became homeless again, and she had younger siblings, and she's a parent herself of a toddler, and she allowed Mom to live with her, and ultimately lost her voucher. And I was devastated, just because it was just sad to see, and it was sad to see the cycle. Here we are again, and her mom struggled, and I think her mother struggled all of her life, and this young woman felt like she needed to take care of her mom, although it wasn't her responsibility, and she had a young child, struggled with employment. The father is around, but also struggles with employment and holding down a job, and so income was and has been an issue. So we're still working with her, and now that our age has increased, she can come back if she needs to, which is great. Our door is always open for youth that maybe don't make it the first time.
Yep.
So it's
Thank
great.
you so much. Those are all compelling stories. I think many of us have seen could support that experience, and thank you for sharing that.
Absolutely.
I think we're going to ask the panelists about gaps in services, but you want to take?
Yeah, if you wanted Dominic to talk a little bit about what Equinox is doing with youth services.
Sure. Equinox, as you know, has a transitional living program, 16 to 21-year-olds. We are co-ed. Typical length of stay right now is up from last year, about probably a 40% increase. We're averaging probably 9 to 10 months the length of stay. The previous year there was a lot of turnover because the kids, it's a voluntary program. They can come and go and sign themselves in and out as they want. We try to discourage them. Obviously, we want to keep them in the services. But we've seen an increase with them wanting to get the services, the group that's there now. I have a waiting list pretty much nonstop. I wish I had more beds. It's really spiked that I've seen in the last year around here. We also offer the street outreach up at the Youth Drop-In Center at 95 Central, which is another outlet for these kids to come to in the area. And we also do Project Independence, which is older, which is a housing program. When they get through TLP and kind of make it through there and they're doing what they've got to do, and we try to get them next door into our apartments. If we have a 59 Dongan attached to the back, then we try to transition them from there out into Project Independence, and they're on their own, and they're pretty much on their own. We do subsidize their rent through the federal program. Equinox pays a portion of the rent. They are required to pay 30% of their net income for the month. We are currently going to reopen our SILP. We're targeting July 1st. That is right now in OTDA's hands with the concept paper. We still have to get down the road for that, but we are going to be moving the kids that are in 59 in those 5 apartments to where our old shelter used to be in the front of 35. And then that 5 apartments will be for 8 SILP beds. And we're going to partner with St. Anne's and try to work with them. So if they have an overflow and we have a bed open, we can go back and forth. That was the goal. We've got to finalize a lot of plans on that, but we're targeting July 1st, hopefully. Supported Independent Living Program.
Supervised independent.
Or supervised, excuse me. Right.
They're still in foster care.
They're still in foster care. Other than that, right now what I've seen a lot in barriers is medical. We get a lot of kids that come in that don't have a provider, haven't been to a doctor, don't even know what a dentist is, and it's a big barrier getting them set up. We've just partnered with Whitney Young to bring their mobile van in, which has been a great asset. They come in twice a month right to 35 South Ferry, and the kids can get referred to anybody they need to get referred to and get seen by their van. One of the other barriers that I think is going on right now in the Capital District, and I can't speak for everybody here, but I'm getting an influx of more immigration, illegal immigrants. I've got 2 right now, and it's tough to get them what they need, especially with no Medicaid. It's really a tough situation. We've seen a big spike in pregnant teens. I have 1 parenting teen right now. I wish I had more beds. I don't, but I get a lot of people that come to the door and refer them, and they can't either be home with mom or grandma. They can't be with a relative. They can't be with a friend. They have nowhere to go. And that's where the majority of our referrals come from for Equinox. It's from the community. We will at times get calls from other agencies, especially domestic violence. Is big with these teens. We'll get a lot of calls. I just got a call from somebody in Utica looking for a bed for somebody that was in a DV situation, but their family's from Albany, but they were out there. So it's a myriad of things that we deal with and that we see. It's come a long way, but it's got a long way to go. I wish the funding, obviously we all do in this room, wish the funding was better. And we can have more programs and more services, but right now I think we're very limited to what's going on.
Thank you. Yeah. So one question we wanted to ask the whole panel, and also we want to involve now Q&As from the group, is gaps in services. And we'd like to hear not only from the panelists, but from everyone in the room. But first of all, are there any general questions for any of us up here? Yes.
Any of the states take referrals from other counties. I know
Yes.
consider Columbia to be not part of the capital district.
Yep.
But Columbia and Green County themselves have no shelter resources.
Yes.
People just living in motels and then waiting lists for that.
Yeah. Sure, I'll let the group speak, but absolutely, if you get federal and state money, you can't turn individuals away based on where they've come from. But Margaret, you want to
Yeah,
take
yeah.
that?
I mean, we've had kids out of state. We've had kids from California that have come up here. You know, they find somebody online, and 2 weeks later they're kicked out of the home. So it doesn't. We have no restriction on that.
I would say from the 13 to 17 population, it's a little trickier.
Sure.
We try to maintain contact with schools, so most of the time either youth is enrolled or not. So we are kind of bounded sometimes by a 50-mile radius from the shelter. That's where we get reimbursed from the state to get kids back and forth to school. So depending on how far that youth is, if they're still going to school, that may be a challenge as far as some of the sheltering.
But an agency, if they had other resources that they wanted to plug in and not be reimbursed from the state for that transportation piece, they can certainly take that youth. That's an agency decision.
Right.
That's not a regulatory decision.
Yeah. The summertime would be a wonderful time to work with that youth. But if they really need to be back and forth to school, it's a little trickier. But yes, yeah, we can definitely. And we have kids that come through our youth shelter that have signed themselves out, or they've dropped out of school, right? So we're trying to work on other things that they can do, with trying to fulfill the task or maybe other, programs that they may be able to get themselves into.
There was a question back there. Hi.
This is so everybody can hear. So the microphone helps everybody who's live streaming hear. So.
Hello? Okay.
No,
Hi, Margaret. You said that your age increased. I was just curious, what is the age limit now for the Wait House?
Yep. So for both programs, it's 16 through 24.
Through 24? Okay.
Correct.
Thank you.
Yep.
That was all.
Other questions?
Rachel?
So I have a question about reunification.
Oh,
Sure.
Yeah.
So our virtual audience.
That's right. So everybody can hear. Yeah.
So my question is about reunification with the family for youth. Is that typically the end goal? And then I know that you guys have talked about some opportunity for permanent supportive housing for youth. But what do you do in an instance where the youth wants to reunite with the family wants to reunite, but you know that it's ultimately a very toxic situation? How do you kind of help navigate that?
well, do you want to take that? Well, for emergency shelters, go ahead. You talk about it.
No,
you talk
we'll all
about
take
it.
a shot at it. How
I
about
think
that? Yeah.
the way that we approach it is that we just continue to offer our services. We will still be here if that doesn't work out. You can come back to us as many times as you need to, and please give us a call if you want to. We can make referrals to other community organizations if you need it. But we really are, we want to support people in their own goals. So if their goal is to reunite with that family, we just want to make sure that we have the wraparound services ready to hand them if they need it.
Margaret, did you want to?
Yeah, I'm very similar. And actually, any 16 or 17-year-old, and this is with a grant that we have with captains, aftercare services are offered to youth, but the youth, it's not the guardian who has to say yes, it's actually the youth. And that's an array of, so that'll be a staff member that can go to the home and possibly do some mediation or something like that. So, I mean, we encourage it, if we think it's going to be a good outcome or a safe outcome. Unfortunately, sometimes our hands are tied, but, we'll always, our doors are always open, so.
Alex?
I think my question piggybacks off of what yours was, but it was basically what are the permanent housing options for youth under 18? So I think that was kind of answered, but yeah.
It's rougher. Let's put it that way. Because a family is
Non-existent.
ultimately
Very limited.
Yes.
Yeah.
Right, and I think that's a gap, that we all see. There aren't many options. Even if it wasn't a supportive housing, a youth that's 18 or 19 isn't. A lot of them aren't ready to live out on their own. And we've assisted with our STEP funds, our rapid rehousing funds, assisted them in their own apartment, but. So many times we see them again just because they don't have those skills, those independent living skills. They've never had them. So,
Kevin?
I'd like to ask the panel their opinion. I've had the impression that family reunification and welfare reform have had a significant impact on youth homelessness, in my experience anyway. And and that it's great to see the breadth of services here, and that's a counter-narrative, I think, to what that message, that negative message has happened, because I think the negative part of the message is that family reunification is the goal. If you go to the Department of Social Services, which is the primary intake for all needs, that's going to be the message that's the culture. And so we're seeing many youth that we used to see coming into our shelters or reaching out to outreach now not doing that because they know the system is hell-bent on family reunification. And many people, many youth are making the decision to stay away, whether it's a good decision or not, from their family. And I just wondered if you all had the impressions that Department of Social Services are on the same page that homeless services are about offering this breadth of services and focusing on youth self-determination versus plugging people back into their families.
Well, Alex is. Oh, you don't want to talk about it? Oh.
I think you're putting her on the spot.
Oh, sorry. Oh, okay, because she's from DSS.
Yeah.
Well, I guess I would say that you're right. The Welfare Reform Act of 1997 was just a big turning point because, as you know, young people couldn't open their own cases anymore. And so that was, changed things a lot. I would say that from my experience, and Alex is going to have to back me up by saying either yes or no on this, DSS usually says pretty much you need to go back home. And if you don't go back home, we're going to take your parents to court and we're going to sue them. And no kid, no matter how much abuse and neglect they've suffered, wants to sue their parent. Having said that, the other side of the equation when you're asking about reunification, that is by statute, reunification, the goal of kids at the shelter, not in transitional living, but in the shelter, unless it's an unsafe situation.
Right.
That puts the onus on the program to develop all kinds of resources, mediation, clinical staff, etc., to do those family reunification meetings because they're bare, for a lot of reasons. But it's tough. But I wouldn't do a program that didn't have that as a component because it just becomes a vicious cycle.
So my name is Alex Myers. I'm a client support specialist at Albany County Department of Social Services. A major role of mine is, it's not eligibility, but connecting special cases, and I work a lot with, an example of special cases would be youth. And a lot of what we do is we do rely on our relationship with Department of Children, Youth, and Families because, unfortunately, children coming into Department of Social Services under 18 are unaccompanied youth. So we try to bridge that gap there. That's not always the best option for some families, but we do have, services that might get connected, whether they're through prevention and things there. But in terms of the system being caught up with the needs, we're trying, I guess.
Yeah, if I could add to that, Mary kind of alluded to it. The 13 to 17 is a little different population with family reunification, right? And that's our main goal, just like you said, by statute, federal, state, that's our goal, right? Because we want to try to see if we can repair the relationships and and a lot of times we are. It's sometimes a misunderstanding or a problem, and when it's extreme, then we look for the alternative housing. But, our reunification rate's like 85, it's a hovered right around there, 85%. But the door's always open, like Margaret said, so if things start to fall apart, so we try to stay on that preventative side as well. They can reach back out, we can see if we can do a break, if we can get an aftercare out there, we can do things. But once you cross over into that 18 to 24 range like you're talking about, then it is more of a systematic issue, right? That's a systematic problem and it's evident from the youth count, right? So you saw the increase on the street, right? The kids are not in some sort of supportive services or other getting access to mainstream benefits. They're on the streets making the way. And so that's a problem. That's a gap.
Did anyone else on the panel want to?
I will add, as far as DSS, I know I can speak for we work a lot with Warren County and Washington County, and actually Washington County DSS, I don't know if it's maybe been 3 years, but they actually have their own homeless unit, and they have a case manager, and I don't know, I'm sure there's a lot of other counties too that are kind of moving in this direction, and that's been helpful for a lot of our youth. All these youth are transient youth, and we're seeing more and more kids come in. over the age of 18 that have a lot of like disabilities and don't have any services and should have had services as a child, and to get those services as an adult, it's very difficult. It's very, very difficult. So that's one thing that we've seen an increase of, and it's double the work for the case managers in a much shorter period of time. By the time we get services, I mean, we just had a young man who was lucky enough to go back to Social Security office, but I mean, he's like off our radar again, and this is a gentleman who has a TBI and really needs services, and he's just, and this is, the life that he's lived, and because of those disabilities,
That's a tough one.
Yeah,
Really tough.
It is.
Really tough. Are there questions?
Questions from the audience? If you don't mind just saying where you're from.
Hi, I'm from Rensselaer County Mental Health, but my question is more about education, because you said one of the big risk factors were a lack of a high school diploma or GED.
Number one.
And I just wondered if you keep statistics about how many youth were in special education or maybe diagnosed with a learning disability, and if there's more that could be being done for those youth in school, maybe like with job readiness programs or something that you guys notice. So,
Anybody track that?
Basically, in our program, we're averaging probably 35 to 40% have the mental health issues. Okay, as far as affecting education, it affects it a lot. We have to use the IEP services, CSE, and all that. We help them with the schools when they go into the public schools here in the city of Albany. The other part of this is, as far as tracking it, it's not something that we particularly track all the time. It's something we've just started to look at because we're trying to get, which we just received a grant to have an educational case manager and a career case manager that would strictly work on those aspects with all 17 kids. So that will be one of their points to really look at each of them and see where that, where it kind of falls. But yeah, we get it a little bit, but not a lot right now.
Could I ask just a question of Rachel with HMIS, just on that note? Yeah, so could you just say does HMIS capture any of the information that was asked?
Yes. So do you want me to take the mic?
Yes.
Have a little while.
So in HMIS, there's a special needs section that does capture if a developmental disability maybe contributes to special needs, and that filters right back into permanent supportive housing opportunities, because if somebody, this is all based on self-reporting as well. So again, if you're looking at youth who have received these services, getting them to admit to having a special need may be difficult, but in an ideal world where they're self-reporting honestly, if they give that information, it would directly connect them to a permanent supportive housing opportunity when that's available, just because of having that disabling condition. So yes, that is captured in HMIS.
Kelsey?
Yep.
Sorry. So CARES works with numerous communities where there aren't any youth-specific services. And Andy, I love this diagram. It's wonderful. It's super informative. I'm wondering, and this is probably a difficult question, but if we're working with a community that has no youth support services, where do you start? Like looking at this diagram, do you start with street outreach? Do you start with permanent housing? Like kind of, do you build on resources of maybe mainstream homeless service providers? What's your recommendation?
Is the caveat no extra funding, Kelsey?
If you're looking for funding, so it's interesting. We went out to Ithaca. I think I'll relate this a little bit. So we went out to Ithaca recently to look at how they're running their supportive housing program for youth, and they had kind of started with TLP, and now they've gone on to doing a permanent supportive housing. So they're missing the piece of sort of a drop-in center youth shelter. They're really interested in how you do a youth shelter. So I think it depends on what current resources might be available. So if there would be an adult system kind of set up for adult sheltering, or maybe outreach or things like that, they're going to definitely be seeing the 18 to 24 to 25, and then possibly with foster care, that's the way that's set up. So in my opinion, I'm coming from the RHY world here a little bit more, but I think it is more about emergency shelter because that gives you a pulse of what's really going on, because then you'll know that there's this population, there's this need, there's that, where you can typically serve a lot more kids coming through because of short-term program, and you get them set up with the other services they need. The street outreach definitely feeds that, because then you're actually in the community talking with providers, talking with the kids, talking with school liaisons. I think that is the two what I would start with to get your real needs, serving a need. Yeah, yeah. Because it's usually the higher transitional living program and permanent supportive kind of come after, I think, sometimes, yeah.
And I would just add to that, if you're really asking where to begin, certainly don't want to put this on the Youth Bureau, but, you could start by a call to whatever the county's Youth Bureau is. They are very well informed in terms of what the services are and can recommend who to call. Mm-hmm. Would that be accurate, Nicole?
If they receive runaway homelessness.
Yeah. Yeah. Right.
Yeah, and some communities may not have even responded to that. I'm not sure. Robert could probably say a little bit better about this. How many counties actually respond with a runaway and homeless youth plan as part of their county plan? And not all do, right? Not all receive funding. And then, so you do have definite pockets across the state that don't even have that on their radar, right? They've got runaway and homeless youth, but they just have not put it on the county plan whatsoever. So we're fortunate in the Capital Region to be much more tuned and focused and have resources for youth. So.
Any other questions? We have 5 minutes. And while I'm walking the mic, could I ask one question? Is STEP an eligible expense for youth shelters?
Yes. Short answer?
Absolutely.
How do you prioritize? I know you all have waiting lists. How do you prioritize? Are you doing first come, first serve, or is there a scoring system? If somebody who has a disability, by length of how long have you been homeless? How are you doing this? Is this fair to ask if it's not?
Yeah, we could ask the programs.
Ask the question. It's a great question.
Absolutely. It's a really good question. Go ahead, anyone.
We do, well, no.
Basically,
coordinated entry.
What we do is we break it down into certain categories for TLP. We look at, number one, is it an emergency situation like DV or physical violence anywhere, drugs, alcohol, weapons, anything like that they got to get away from. Then we look at, do they have somewhere that they can actually stay and be safe for a little bit, or do they really need to get out right away? And then we look at the whole situation as a whole with the case managers, and we'll discuss, what's the best option? Can we wait? Do we need to really push them up the list? And we kind of juggle the list that way based on emergency need.
Coordinated entry, yes. So we've been doing that. Andy can probably mention how long it's been going on, but it's, as other continuums, it's still a work in progress. But so our emergency shelter transitional living program, they all participate in coordinated entry. So it's not first come, first serve as it used to be. It's based on the need. So
Vulnerability.
Yes. And kind of the higher the need, the more bumped up you go on the list, and everyone goes on one large waiting list. And there's several, I don't know how many organizations right now are involved in our coordinated entry process, but it has been beneficial as far as, those people can get housed in, really where they need to be housed, whether it's a substance abuse facility, mental health, and they're all permanent supportive housing, although we do have shelter, some RTLP, and like I said, STEP and Captain's Shelter is on there as well.
I'll let Natalie see what she says, and I'll give you a quick primer on the coordinated entry. Yeah.
So our emergency shelter programs tend to run on a first come, first serve model, and that has to do with, like, if a bed is open and somebody is literally at our door, we tend to take them in. That's why we really love our cold blue season, when we could take everybody in. And then for our supportive housing programs, they also run the coordinated entry model.
And I'll say our youth shelter, and I'm sure St. Anne's could be the same way, is sort of the first come, first serve. So we, definitely take every referral, review every referral. There's probably a few disqualifiers as far as somebody that was a sexual offender. We wouldn't want to bring them in, or a fire starter. It's probably not a good idea for us we're not the most appropriate program, let's put it that way. So, but it is definitely first serve. But as far as a quick primer, if nobody has ever heard of coordinated entry, there is a group, a continuum. So it's set up by county or larger. We're part of Saratoga North Country, so it's Saratoga, Warren, Washington, Hamilton County, but some are usually just Schenectady, Albany, Rensselaer. Money that flows through HUD then requires those agencies that are providing homeless services and taking that funds to provide those services work together as one great big group to solve the issue as a whole. So DV, chronic, family, individual, youth, all working together on the same plate, on the same, and so that's where you have an assessment form that's common to everybody, right? So somebody presents, doesn't matter, well, I'm not sure if it's open door or wrong door for most programs, it usually is, or one place where all the information is sent, but they fill out a common assessment form, they get a vulnerability score, they go on a list, and then from there, housing providers, when they have an opening, should be going to that list to say, okay, here's the most vulnerable in our community, we should be doing that. So it's a big change because most programs have developed their own wait list, right, or their own resources and networks over years, 20 years or longer, of how we get referrals and things like that. So it's a shift. It's a kind of a sea change shift for those programs that now have to use, what I'm getting now, this list I have to go from, and if you use Housing First model, that's, another challenge because you're not really looking at the candidate that might be the best for your program. You're looking at who's most vulnerable. So, but it's something that we all need to adopt, and it's all something that we need to work on because to serve the most vulnerable it's important. But I will say, youth have been late to the game. Let's put it that way. So they have not been a part of coordinated entry or continuums very often because there wasn't the funding, as Mary mentioned earlier, right? So they're not required to be there, and usually they've been left off to the side table somewhere, or maybe not even invited to the table. So we've had to kind of force our way into it in some situations, or been asked now that it's become a priority, but we're playing catch up. And many times the continuums and coordinated entry don't have a very good youth track. So sometimes the assessment puts, chronic adult and youth all in the same assessment form, and their scores reflect based on that. So those continuums that are ahead of the game with a youth-specific track are much better set for dealing with the youth issues and dealing with housing for youth.
So I just want to ask, in wrapping up, if anyone has anyone on the panel, anyone in the audience, any comments. You don't have to ask questions, any concerns that weren't addressed. And then I think we'll adjourn.
Great. Well, thank you to our moderators and our panelists. Let's give them a round of applause. That was great, a fantastic amount of information about youth homelessness just in our area, and we really appreciate you taking the time out of your busy schedules and the important work you do to be here. We just want to promote our next and final Partners in Progress workshop for the season. This is going to be on June 6th, and it's a special all-day event, so it's going to be from 9:30 to 2 o'clock at the University at Albany. We're going to be talking about challenging ourselves to confront discrimination, a review of policies and best practices for homeless service providers. So we really hope that folks from each of the communities that we work with come and we can talk as a community about how we can better address and confront any sort of inequities going on in our services and move forward. So that one, just to let you know, that one is only in person. It won't be live streamed. Again, thank you for being here. Thanks for taking time out of your schedule to participate and learn.
One thing real quick, so that summary is only a summary, so there's going to be a larger report coming out in August with all those numbers, much more data. So if you're interested in the data, if you're interested in the information, you definitely are in August.
Thanks so much.